Fabulous question. Which vaginal moisturizer brand would you recommend? As an NHS GP, I don't work for any brands, but this is a common question that I get asked in my surgery. So let's break down some of the vaginal moisturizers that are out there. It's important to understand your own vulval physiology. Are you somebody that gets recurrent urinary tract infection? Have you had bacterial vaginosis? Or are you somebody that also gets maybe recurrent thrush infections as well? Well, that's when vaginal moisturizers, you need to just be really careful about the ingredients. Not all vaginal moisturizers are the same. When it comes to using something for my patients, I go through that history and I say to them, it's something to be aware of, because some moisturizers can make you slightly worse. A lot of the moisturizers that are out there have hyaluronic acid, so that stuff that we use in our skin that makes our skin nice and plump. Well, that's exactly what we need, because we need something that's going to absorb water and moisture and keep that within our mucosal tissue in our vulva and vagina and keep a steady pH as well. So I tend to recommend Yes for my patients. So that's vaginal moisturizer. That's what the packaging looks like. And for Yes, what this does is it treats symptoms of genitourinary syndrome of the menopause and also dryness as well. It alleviates irritation, itching, and burning as well. There's no fragrance to it. And the most important thing is to look at the ingredients in there, because it's not got any glycerin in it. And I'll come back to later why glycerin is important. So the other one that I recommend is also Vagifem as well. Yes, I've raided the cupboards in my pharmacist. Sorry, Sam, that I've done that. But Vagifem also is a really good vaginal moisturizer as well. And this comes as a tube that you apply, and it treats vaginal irritation, vaginal dryness. Now, there are lots of others that are out there. You also have got Replens, you've got a Regel as well, you've also got Silk. And the thing that with some of those, not that they're bad in any way, they work really well for a lot of my patients, but they have glycerin in them. So glycerin can, for those that are predisposed, or maybe that you have a history of getting recurrent urinary tract infections, or maybe that you have a history of recurrent thrush, particularly if you have a history of thrush, then if it's got glycerin in it, then it can make that thrush infection come back, or it could mean that those thrush symptoms could irritate you. So it's the glycerin bit that you need to be careful. But if you've never had those issues, then actually using something with glycerin in it is absolutely fine. The other thing is that lubricants are so important. So it's not just for sexual activity. Some of my patients, I recommend lubrication as well as a vaginal moisturizer. So using something like Oestriol Rich or Oestriol Luxe are brilliant products in order to assist with that. Again, it's that for your comfort, but also to make sure that, especially if you have vaginal atrophy or genitourinary syndrome of the menopause, that you're thinking about using a good moisturizer and a good vaginal lubrication, because sexual intercourse should never be painful and should be as comfortable as possible. I hope that's really helpful for you, and by all means follow, and I'll try and get some more women's health content for you soon. Okay, bye.